Well, first, Cynthia, I mean, how are you feeling? How does it feel to be the first in the country, the first person in a nursing home to get this vaccine?
First of all, they came to my room this morning. I was amazed by it, but I feel great about giving them first shot. Have no bad ill effects or anything.
Were you nervous at all about it? So you said you found out this morning, so that this wasn't something you really had a lot of time to necessarily think about.
No, I didn't.
Were you nervous at all about getting this vaccine? I know a lot of people have questions about whether they should get it or not.
No, I think that anybody that can have the move vaccine should have it.
What has sort of life been like for you during this pandemic? I know sort of how things are done up here in Ohio. I know you live in Florida and they've handled things a little bit differently. I just want to sort of know what this pandemic has been like for you.
Been different, having to go out with a mask on or having to shop with a mask on. But it's not anything different now than it was back in, say, February. I started wearing a mask, and so it's just like part of everyday living now. And that was.
Go ahead.
No, I'm finished. That's fine.
Okay. How long have you been there at the ManorCare in Palm Harbor?
3 weeks.
Okay. What sort of was, I mean, I assume you've gotten other shots, other vaccines. For someone that doesn't necessarily know what to expect, is this just like going to the doctor and getting your flu shot? Is that pretty much the same?
Yeah.
The same setup?
Yes, exactly like that.
Okay. Do you know anyone? Has anyone in your family had contracted COVID or anything like that during this whole time?
No, they haven't, because most of my family lives in Michigan, in Adrian, close to Toledo, and they wear masks anytime they go anywhere.
Okay. So are you originally from the Adrian area?
Yes, I am.
Okay. What took you down to Florida? Just time to get away from the cold weather?
When I got married and came to Florida.
Okay. So I mean,
you got married to Florida. I wasn't sure if you caught that.
So you said, I mean, you didn't have any doubts about getting the vaccine. Just sort of what would your message be for everyone else that's still waiting in line to sort of get this vaccine?
I believe that everybody should get the vaccine that can get it. I don't know what the exactly the parameters are for not getting it, but anybody who can get it, they should have it.
Because it's just time to get this over and done with and to move on, right?
Yeah, to get this out of our country.
Yeah. Okay.
Cynthia, normal, no mask.
It's time to get back to some normal. Absolutely. What have you sort of missed the most that you haven't been able to do during this?
Going to the movies. That's my thing.
Yeah.
I used to go to the movies by myself. If I wanted to see a movie, I'd just go.
Okay. All right. So you got your first shot today. You'll get your second one. What did they say, in about 3 weeks? Is that the plan?
Yes, that's correct.
Okay. And I imagine you'll be counting down those days until you get that second shot. Did they sort of say what comes next then after you've gotten that second shot? Are you sort of free to?
No.
Okay. They didn't cover that yet. Okay.
No.
Okay. All right. Well, Cynthia, those were pretty much the questions that I had. I'm very happy that you were able to sort of be obviously really early on in this, and I appreciate you sharing you sort of sharing your message will get it out to our viewers here in the Toledo area. I think the most important thing is that people understand that if you can get this vaccine, it's a good idea to do so. So I appreciate you sharing that message.
Thank you. Appreciate time.
All right. Thank you, Cynthia. All right.
Thank
Tasha.
you.
Yeah.
Be good, Tasha. So I was just gonna, I know you asked the question about what comes next. And so we did talk a little bit about that just in case you wanted that feedback. And our Chief Medical Officer, Dr. Gloth, was here on site today as well, because we actually had done over 110 vaccines by noon, the first 3 hours. So really good response. But he said, really, until we really know and until we've got vaccinations that happen really at a higher frequency across the entire country, that we will probably still continue to use the PPE. We'll continue to have to wear the masks, because that was the first thing we all said, because we get tested every week. Great, we got vaccinated. Once we get the second one, are we done with these masks? Are we done with the testing? And he said, no, not yet.
Right.
So it's still a little bit of time to go before we actually get to clear completely. But like he said, what makes us feel much better now, though, is our patients are at a much lower risk. So if their family wanted to come visit, we're less concerned now that the community would give them the virus. Or if they wanted to take a leave of absence, which families, we've not allowed patients to do because of risk in the community. Once they're vaccinated, then we know we have a much lower fear of the patient actually contracting the virus if they were to go out to lunch, for example, with their family. Do those sorts of things. So I think from a communication, interaction, and socialization standpoint, the vaccine provides a layer of safety.
Gotcha.
So it's not going to clear all these masks. I know she hates
Sure.
that. That's the biggest thing, and she can't stand the mask. But it'll be a minute longer, and we will have the vaccines here on site for day 21. So that is the plan, that are right around 21 days, the second dose comes in.
So you said you administered around 110 by noon. Is that sort of the amount that you have there for that facility? Did anyone refuse it? Any of the residents refuse to get the vaccine?
We have been very fortunate. We actually got 100% compliance from all of our long-term care residents. So, and we have some long-term care residents, and we have some shorter-term residents, which we did offer to everybody in the facility, but we did have 100% compliance with all of the long-term care patients and their families if they were responsible parties. So we were thrilled by that. And our staff, we did over 50% of them today. We don't want to do them all at once, because just in case there is some side effect, right? You don't want to vaccinate 100% of your staff, and then if they've got side effects, they're not coming to work. So they don't expect any significant side effects, but we did half today, and then we'll do the other half, hopefully at a date near in the future, because we're also partnering with CPS. So yeah, our staff really stepped up to the plate. There was actually a level of optimism and excitement in the room. You could just feel it. The staff was lined up out the door, through the lobby, into the parking lot in order to get their vaccinations today. And it was all voluntary. So the response was extraordinary. Yeah, from our staff, and certainly, as I said, 100% compliance with our long-term care population. So I think we'll probably, I don't know, at the end of the day, maybe 150, probably 160, I think, by the time we're done. They're still right now, they're doing the cart room to room right now. So for the patients that weren't able to come into the clinic, the staff we did in a clinic in the community area. And so right now they still have the cart, they're still doing vaccinations room to room. So I don't have a total count yet. We're still issuing them.
Okay.
They kept making them.
Okay.
Yeah. Was that what they brought? Sorry, so they brought 350 with them. So that's
Okay.
how many had available.